Hi, my name is Steve Walker. I'm a physician and anesthesiologist in Dallas, Texas. And today I'm making this video to show you how to convert a Snorkel mask into a filtered mask for the care of COVID-19 patients. The system I have here is very easily made. It takes about 15 minutes of actual work. The parts are simple, standard parts that can be obtained easily. The usefulness of this mask is such that it helps to conserve PPE. What I really feel like this mask could be useful for is continuous use for providers who are exposed to COVID-19 patients, intensive care workers, anesthesia providers, particularly during intubation and extubation when there are aerosolations happening. PACU nurses who will then be taking care of these patients after surgery. And finally, the emergency department personnel who are on the front lines. This disease walks in their door, and they are directly exposed immediately. The finished product looks like this. It's a head mask, and this is the business end right here that we're going to talk about today. You can fit a filter under this very nicely. These masks are available on Amazon. My modification specifically uses the head mask. This mask, the lower part of it, here's an unmodified one. The lower part of it isolates the mouth and nose from the upper part of the face and the eyes. The air is channeled down, you breathe in and out down here. There's a one-way valve that you breathe out of right here. This is a standard scuba seal on this thing. It's very effective. Chin fits right in here where my fingers are, like that. And if you have it fitted properly on your face, it will make an excellent seal. You need filters, of course, a standard anesthesia circuit elbow, a standard elbow without sampling port. That's extremely important. And depending upon how you modify the mask, you may need a 3 centimeter, 5/8 inch inside diameter nylon tubing. You can buy about 100 feet of this tubing at Home Depot for $4. Tools that you need are right here. Some tape, a Leatherman tool, a pair of diagonal cutters, or as electricians call them, dikes, a Dremel type tool. This is a Drill Master, which I purchased at Home Depot for at Harbor Freight for $9, and a hot glue gun, which I purchased at Harbor Freight for $3. Hot glue is very safe. It's ethyl vinyl acetate, and it emits no volatile organic compounds. I'm going to take the brand new mask, and you'll notice, if I compare the two, that there is a cage on this mask over here with a little ball inside. Over here, that cage is missing, and it has a couple of one little protuberance on each side, about a little less than a centimeter long, that I left behind when I took the cage apart. And we use that to help anchor this elbow in there. So you take your dikes, and using the flat side, come in and start snipping this cage. I'm going to snip here, turn it over, snip on the bottom. Doesn't take a lot of strength, it's actually pretty easy. And then I'm going to start cutting these sides. And you'll have to cut them up just a little bit initially, just to get them done. Turn this back around this way. I'm waiting to cut the bottom one because it's thicker. It's harder to cut. Now I'm going to cut this thicker one, and it takes a little more effort, but now I have more room and I can really get at it. So. Okay, now that I have the opening and the channel prepared and smoothed out, I'm going to take this blue thing off. It's tempting to try to take it off by the little white nipple there, but don't do that. You'll never get it off, or you might cut yourself. take a knife and put it in the slot, the opening between the white part and the blue part. And just work it up like that. Just tip the knife that way. And it comes up, it comes off very easily like that. Now, inside here is a silicone valve that's used for the snorkeling mask. The edges of this valve also provide a seal around the edge of this, which we really want. So don't take this out. Just set this thing aside and we'll use it again later. Okay? Now, this is the elbow. I'm going to put the elbow on, and it turns out that the thing we made allows the elbow to fit in very nicely. We want to turn the elbow completely to one side as much as possible. Also, we want to put a bearing on the elbow, which is our 3 centimeter vinyl tube, and it makes it more snug. In fact, I have to sort of force it up in there like that. Now, it's up inside the mask, right here, and we want it resting on the bottom, yet turned to the side. So we don't want it up like this. We want it resting and turned to the side against the little nub that I left on here, okay? So I'm going to be holding it tight because the next step is to hot glue this with some hot glue spots. Here's my hot glue gun. First, I'm going to put a little dab of hot glue right there at the connector, just like that. And then one underneath, right there. And you can use a lot of hot glue. I mean, this stuff is so good. Really does a nice job. Then just hold it until it hardens. And that tacks it down. You can even blow on it. Okay, now I'm still hot gluing, and you can hot glue these channels on the side here. You can see this going in there, like that. Now I've already hot glued the other side. You can just use as much of this as you want down here. I'm hot gluing the arch around the top. But the most important part is to hot glue the top of this so that no air can get through. And I've already done some of it, but I can see just by looking down the top where the gaps are. And you probably can't tell on there, but I can, and you can too when you're doing this. You can just look down and you can see where you need hot glue. Now, one of the things about this is you do not want hot glue to get on the flat part of the top of this snorkel, because that's where your silicone baffle will be to protect this thing for air exchange. So if you do get some on there, it just scrapes off with your fingernail. It's very forgiving. And I still see some gaps. Then I'm actually going to use my knife to clean off the flat side, although your fingernail will work just as well. I just like using my Leatherman tool. I'm just cleaning off the top of this bearing here. Make it a little bit more substantial. You want it to be cured a little bit when you're scraping it off, because it comes off gooey. It still leaves some behind. Okay. Now let me look at it, make sure I don't have any holes for air to leak through. And it doesn't look like I do. Okay. Then take this silicone seal here. You can pull it out of here and do this, or if you are confident, you can fit it around this, which is the way I'm going to do it, and put it right over, you see that? The hole there, and push it up in there. Make sure it's in there before you seal it down, and it is. I can see that it's in there. Now, I'm going to push this thing down on there, and hear the click. We're done, okay? This is the device right here. So, if I test it later and there's a leak, I can take the top back off and put more hot glue. But this looked pretty good. Now, One question people ask is, how do you know that the mask is good for your face? And I want to show you how to test the seal. Pull the head straps out of the way, take off your glasses, fit your face with your chin in this cup right here, and the seal around your face. Put your thumb over the hole and suck in with no straps. Take your bottom hand away. You should be able to support the mask on your face with just the vacuum of your thumb. Now I'm going to put this thing on my face, chin in the cup, and suck in with my breath while I have my thumb over the hole up here. That will also test the vacuum. It'll test how well I made this thing so that no air gets in right here at this port. So I can't talk while you won't be able to hear me while it's on. So a good fit and a good vacuum. So we know that our air seal is holding up here and the thing fits me nicely without the straps on. That's why the straps don't have to be particularly tight. It just has to make a good seal with this rubber seal around your face. Now, if you wear reading glasses like I do, being an old man, I modified reading glasses. You can't let the arms of your glasses stick out through the seal. It compromises it. So these are Walmart glasses. I cut the arms off, cut the nose pieces off, and this thing fits perfectly around the lower part of the face seal. It just pushes down and it will stay there just like that. And it's perfect till it lets you look down if you're old like me and look through the lenses, yet look up for distance vision. It's perfect. If you have prescription glasses, you'll have to work that out. If you have an older pair, you can do that. And it'll fit a little higher in there if you need it to. So let me do a little bit of summarizing now. Advantages of this mask: conserves PPE, it fully protects the provider, has filtered air coming in, can be easily cleaned and reused. It's easy to manufacture with available materials, and it can be worn for extended periods, which I've done myself. Disadvantages: there's a slight increase in the work of breathing. The pore to fiber ratio on these filters is at least 1:3, maybe even more. And so even though it's really easy to breathe in it without a filter, it's harder with a filter on. And I haven't tried this, but I feel like if you put a T-piece on there and put 2 filters on, you probably would have less work of breathing. This thing, if you have the mask strap too tight, can give you a headache. It can aggravate you while you're wearing it, and you're not going to like wearing it. When you're sitting quietly in the mask, the FiCO2 can go as high as about 13 because it pools down here without washing it out. There's about 160 cc's of dead space in the mask. It's cleared back to 1 or 2 with just one slight, or I should say one good-sized breath or a sigh. If you're up and working around in the OR and doing things, the FiCO2 stays between 1 and 2 generally. NIOSH standards are, I think, 2%. Anyway, one further disadvantage is you do have to wear a standard mask down here because this is your breath coming out through this exit port. So a standard mask to cover this so you're not breathing directly on the patient or on other people in the room. Okay, one more thing. Please hit the like button. I want this to be able to get out to people, and if they see likes on this video, they'll look at it. This is for patient and provider safety. I think mainly I developed this for the safety of my colleagues. If you hit the like button, it'll help a lot. Thank you very much. Please be safe.